I fell and now my hip hurts. My doctor says I might have injured my hip and may need an imaging test. What does that mean?
When someone has sudden hip pain after a fall or trauma, the most common cause is a hip fracture, also known as a broken hip. This is more frequent in adults with osteoporosis. Early diagnosis can help determine the best surgical or non-surgical treatment if there is a fracture. Imaging tests can also find hip dislocations or injuries to muscles and tendons.
Do I need an imaging test?
If you have new hip pain after trauma, the first test your doctor will usually order is a hip X-ray.
What if the X-ray is negative?
If the X-ray doesn't show a fracture, but your doctor still suspects one, a CT scan or MRI without contrast may be the next step. These tests may find small or hidden fractures that aren't seen on an X-ray.
What if the X-ray shows a fracture?
If a fracture is seen, a CT scan without contrast is usually ordered for more detail about the injury. An MRI without contrast may also help.
What if my hip was dislocated and reduced?
When a hip is put back in place, a repeat X-ray checks to make sure it is in the correct position. If it's not successful, or if another fracture is suspected, a CT scan without contrast may be needed.
What if it's a soft tissue injury?
If the X-ray is negative or unclear, but a tendon, muscle, or ligament injury is suspected, an MRI without contrast is the next best test. If you develop sudden hip pain after trauma, imaging tests like X-ray, CT, or MRI help your doctor quickly find the cause and guide the right treatment. Talk to your doctor about which test is best for you.